Big changes are coming for January 1st, 2026. If you're on both Medicare and Medicaid in Ohio, your coverage could change automatically to a plan that may not fit your needs if you don't act. Today I'm covering what you need to know. So first things first, what is MyCare Ohio? MyCare Ohio is a program for those enrolled in both Medicare and Medicaid. It was started in 2014 to coordinate benefits that were separate. You had your Medicare and your Medicaid. And it covers 29 counties today, and more are coming next year in 2026. So really what's changing? First and foremost, the government mandated that all of these changes that I'm going to talk about today had to occur by 2030. What Ohio is trying to do is get this done in 2026 so that then we don't have to worry about it. There are a lot of pros. Let's go through them. So what's changing? The current carriers that are able to sell in those MyCare Ohio that kind of are a part of this program are Aetna, Buckeye, CareSource, Molina, and United Healthcare UHC. So the way that it works for next year, we're considering these, all the insurance companies put in bids and they awarded them to 4 different carriers. Those are considered the next gen carriers. Now you'll notice there's only 3 here: Anthem, CareSource, and Molina. There was a 4th, but they didn't pass their readiness assessment. So the state is taking this very seriously to make sure that this program at least gets off the ground well. So 1 care coordinator and 1 organization. So essentially you're going to have 1 group that's going to help you coordinate everything when it comes to your health insurance moving forward. So there'll be 1 care coordinator, as I just said, 1 organization, and 1 ID card. So really the goal of this is to simplify appeals and frankly everything else. It's better integration of medical and long-term services. In addition to that, members are impacted in a few different ways. First and foremost, if you're in one of the 29 counties and enrolled with United Healthcare or Aetna, you'll move to original Medicare and Medicaid only, unless you select a plan. So this is a pretty big deal because for those of you that are on these plans know, these plans include things like dental, rides to the doctor, your prescription drugs. There's just a whole host of things. There's grocery cards. There's a lot included in this. So, I'd highly recommend that if you're on United Healthcare or Aetna right now, that you take a look at this. Your new Medicaid ID cards, you should have started receiving them any day now. They were supposed to go out on October 1st of 2025. And then your enrollment window is AEP, which is October 15th through December 7th. So you can start enrolling now. And then there are monthly special election period opportunities in 2026. So, the way that the other 59 counties in the state of Ohio, because again, I'm only talking about 29 counties for 1/1. The other 59 counties will be rolling through starting in April through August next year. So they'll be kind of rolling different counties in throughout the year. All right, so I mentioned that I thought there were a lot of positives when it comes to these changes. So let's go ahead and take a look at what those are. So first and foremost, access to expanded benefits or new plan options. There's the potential for lower out-of-pocket costs. Really what they're trying to do with all of this is create a more smooth integration between, medical long-term services, but really between the Medicare and the Medicaid, trying to kind of make it one unit so that it's a lot easier to navigate between the two. Sometimes you get stuck between Medicare, Medicaid, your plan, etc. There's improved access to preventative services and wellness programs. There's more holistic care experience with a single plan. There's better transportation options for appointments. And there should be shorter wait times for prior authorization. So really, the challenges, I'm going to be frank with you, these challenges really apply to you if you do nothing and you're on one of the plans or are enrolled in a plan that doesn't work for you. If you need help, I would just give us a call because this is really important. The pros dramatically outweigh the cons when it comes down to selecting the plan that suits your needs. So really at the end of the day, the challenges are the loss of the current provider network. You may need to switch doctors if you don't check out the plan that appropriately works for you. I'm sure that there is a plan out there that does cover your doctors or your hospitals. So it's just doing the work to make sure, and we can help with that. Just give us a call. The disruption in preferred pharmacy. Frankly, the difficulty transitioning continuity of care, possible delays in accessing in-network specialists, and upskilling needed to navigate new plan rules. Again, none of this really will apply to you if you just make sure that the plan that you're either going to be enrolled upon, or if you were one of the folks that I just talked about that your insurance company is not going to be considered one of the options for next year, and you have to select something else. These cons or these challenges, they really only apply to you if you do nothing or don't do the right thing for your specific situation. So really what you can do is review your current plan and provider network. Like I said earlier, the enrollment window is AEP, which is essentially now through December 7th. There are monthly special election period opportunities available in 2026. If you don't live in one of the 29 counties that MyCare Ohio initially was in, then this will apply to you starting in April. And April through August is when we'll roll the rest of the counties in. At the end of the day, if you have questions or you're not sure or you just really want to double check things, give us a call. We're here to help and more than happy to do so.